And it's the time to work together more than ever.
Mm,
Because, for example, as you know, many health budgets are being cut. There's less money for what's important, not just in the African region, everywhere. I mean, the
mm,
moment it starts happening in one region, it can happen to the other region. So,
mhm,
what's our strength? Our strength is working together.
mhm,
Not just say, as a patient advocate, I'm not advocating just for Europe. I'm
mm,
advocating for the African community. I'm advocating for people in South America, all around the world, the globe. And
mm.
what we should do is getting together.
All right. Thank you very much for joining. My name is Ogweno Stephen from the Sterling Foundation, and I'm joined here by Lucia, who will be doing a quick intro to herself, telling us what she does, and then we'll go into our conversation today, which will be around three key areas, talking about non-communicable diseases and lived experience. And then we'll also talk about the importance of collaboration between organizations, institutions, and individuals across the African and the European Union regions as it concerns non-communicable diseases and its advocacy. But without further ado, Lucia, give us a quick introduction to yourself, your lived experience, and what you do.
Hi, Ogweno Stephen. First of all, thank you very much for inviting me to do this interview with you. It's a great pleasure and an honor. Well, I am Lucía Feito Allonca. I am part of the Our Views, Our Voices NCD Alliance Global Advisory Committee, a person living with type 1 diabetes for 33 years, the Blue Circle voice for the International Diabetes Federation.
Mm, very lovely. So, my first question to you to get the conversation started is when we say non communicable diseases or NCDs, conditions like diabetes or hypertension, what comes first to your mind?
What comes fast to my mind, cancer, obesity, the pandemic of the current times, something that is avoidable in many cases and somebody that we have to work on.
Mm, very lovely, very lovely. So, a lot of times there's a lot of issues in non-communicable diseases and especially around involving lived experience. And so the next question is, in one or two words, what would you say is the single biggest daily challenge for someone living with chronic diseases?
Hmm. For the first challenge is access to the treatment that they need in order to survive. And starting from there, once that we are surviving, we need not just to survive, but to thrive with
Mm,
our health condition. And in order to do that, we need many things happening at the same time. Not just the access to the medicine, but we need our societies and communities to understand what our condition is about. What's that? Because we need the understanding of society to treat it properly and to address it as it has to be addressed. But in order to do that, we have to be the first ones providing the knowledge on what's living with the disease like a unique expertise that only people with deep lived experience can bring to the table.
very nice, very nice. And I think this leads very well to my next question, which is beyond just medicine, what is the one thing that makes a huge difference in managing non-communicable diseases?
Of course, beyond medicine, we need community support and mental health support.
Mm,
Emotional well being is essential to address and treat any non communicable disease. So it's transversal to all NCDs. That's why the latest political declarations was on non communicable diseases and mental health conditions interconnected and
mm,
related, that you cannot speak about NCDs without taking mental health into account, because we are a body and a mind, and
mm,
in order to treat an NCD properly, you need to do it holistically, treating the emotional well being as well as the physical one.
mm,
If you don't treat those things at the same time, as well as obtaining social support and means of living, thriving with the condition, working properly, being able to access all the community activities, studying and being integrated, well, it's not enough. So we have to keep on working to improve the whole situation for all citizens living with NCDs.
Very good, very good. Which leads me to a very common question, which I'd also like to hear your feedback on, which is, what is a common misconception, even in your lived experience as someone living with diabetes? What is a common misconception that people in your community have about non-communicable diseases?
Well, there's a lot of stigma, and that's quite unfortunate. But many times there's a perception that we caused the disease that we live with to ourselves. And we see that a lot in the field of not just diabetes, but also obesity.
Mm,
It is a complex disease, and many circumstances come into play. Nobody wants to be sick. Nobody wants to live with a disease. And it's something that not always is possible to avoid. We would love to avoid every single case, and that prevention worked perfectly.
mm,
And there's a lot of prevention to do. But in any case, that's not always going to work and prevent every single case. The
mm,
greatest misconception is thinking that people cause themselves in that due to health style, lifestyle conditions, and other factors.
I think that's a misconception that I even face as well as someone who was born with childhood obesity, that people think that we brought this to ourselves, and that is not necessarily the case. I think
It
that, yeah, you're saying something.
Yes, yes, especially in the obesity field, that is so
Mm,
connected to diabetes as well,
mm,
because we talk a lot about the diabetes stigma, and it's so connected to obesity because these two diseases are related and they appear together in in many cases.
yeah,
It's
it's
I think it is. It's great responsibility for global health, for public health, and somebody has to make others think. We have to raise awareness
mm,
from public health.
yeah. So my next question is about economic impact, and the question is around, just paint it for people who will be listening. How long does long-term illness like NCDs impact not only the patient but the family finances? And if you have some lived experience there, that'd be a great place to add it as well.
Well, NCDs affect not our pockets personally as people living with the condition, but they affect our household. And beyond that, they affect national health budgets, economies, these economies of the region, and economical development. What's the best course of action? The best course of action is investing in early treatment and prevention, screening, because that's always an investment. You are going to save much more money in the long run as a government if you tackle non-communicable diseases from the very beginning, ideally before they even manifest. But well, that's speaking at the national level and the level of governments. When it comes to people living with health conditions, especially in low and middle income countries, there's little that they can do on their own. But that's why it's important for us as patient advocates to educate patients, to let them know what their rights are so that they can organize and demand change. It's so necessary.
Very good. For the next part of this conversation, I'm going to focus on why collaboration is important. And for the longest time, I think we here in Africa, and it has been a common myth across the world anyway, that non-communicable diseases are a disease of the West, and that it affects only the white, the rich, and the old. But this is turning out to not be the case, because now it's affecting everyone. It's on the rise in developing nations. It's becoming a very big issue here in Africa as well. And there needs to be a lot of conversation around cross collaboration in these different regions, which brings me to my next question on, in your opinion, why should Europe be invested in tackling NCDs in Africa? And what do you see as a mutual benefit in addressing this problem across the board?
Well, first of all, despite there are different regions in the world, we are living in a globalized world. Nowadays, what happens in Africa is affecting us in Europe, in America, in Asia. There are no just countries and regions anymore. We are in this together. There's just one Earth and many challenges such as climate change, such as the food industry products. Well, they're becoming global challenges, not challenges that belong just to one region. People are traveling constantly between countries, and the culture tends to be more and more the same all around the world, and the connections are increasing all the time, the internet, etc., etc. So, of course, collaborations are essential to tackle any non-communicable disease, not just in our region, but everywhere. We
Mm,
live in a globalized world. And what's the benefit of it? Well, the benefit of it is that you cannot live in an old style world, let's say it in colonies, have to work on development because you will benefit out of the development and the cooperation that will arise from that development after working with Africa. There's so much richness in Africa.
mm,
We are missing we are missing a lot of wealth in all forms, from the economical wealth to the human wealth, because we have many talents in Africa not being discovered
mm,
by their development that we have to work on in order to buy fairer, more just societies
mm.
where we all live better.
Very good. That leads very well to the next question, still on this collaboration front, which is when you think of a successful collaboration between the African Union and the European health partnerships, what is the first thing that comes to mind? And this could be in the way of funding or technology transfer or doctors and training. What comes to your mind when you think about these two regions collaborating and working together on
What
NCDs?
comes to my mind in this very moment of the world is that the world is changing. At the moment, we are in an unprecedented situation of polarization, political polarization of extremes,
Mm,
in a moment that we can describe as unexpected, where we don't really know what's going to happen. Everything is quite unpredictable at the moment, and it's the time to work together more than ever.
mm,
Because, for example, as you know, many health budgets are being cut. There's less money for what's important, not just in the African region, everywhere. I mean, the
mm,
moment it starts happening in one region, it can happen to the other region. So,
mhm,
what's our strength? Our strength is working together.
mhm,
Not just say, as a patient advocate, I'm not advocating just for Europe. I'm
mm,
advocating the African community. I'm advocating for people in South America, all around the world, on the globe. And
mm,
what we should do is getting together and organizing. Because, for example, in the non-communicable diseases area, patients have to work because it's our interest. And it's not just us patients, it's society.
mm,
Because we will all be patients at some point of our lives.
mm.
More than ever,
Yeah.
all of us, or a family member, or a loved one. So, by doing this, we are improving our societies and securing our life and our well being.
Hmm. Yeah. So, last question before I let you go. Well, second to last now. So, if you had an policy priority that could be implemented across the African Union and the European Union to collectively tackle the problem of non-communicable diseases, what would it be? If you are the president or the head of state, or and they said, choose any policy you want, we will implement it across the two regions or probably even across the world. What would you choose to change?
Well, there are so many things that should be changed, and it can never be only one thing. And that's a challenge that people and policymakers have to face,
Mm,
because generally, while there are many priorities and many objectives, budget is usually really limited. So I think that a good point to start would be investing in prevention and
Mhm.
detecting patterns. How are non-communicable diseases evolving in this area? What are the latest trends? What are the number of people living with this condition in this region? Why is the number increasing? Also, trying to work on prevention policies and at the same time guarantee access to those affected by the non-communicable disease, and also tackle actively the reasons why this trend is happening, why there are more cases than before, because unfortunately it is a global trend that
Yeah.
there are more and more cases.
Mhm. Yeah, thank you very much for joining us and for helping us to flesh out more about non-communicable diseases, lived experience, and a little bit more also on partnerships across different continents. That brings us to my very last question, which would be, what would be your key takeaway or key message that you'd want the individuals listening across Brussels or Addis Ababa or across the world? What would be your one message that you'd want to finalize this conversation with?
My key takeaway is that it's important to work at the global level. Let's do it together. And that it's long due obligation of the world, a duty that we have pending to gift more power, the power that they own, to the global south and especially to Africa.
Mm.
So those are my final words. More power to Africa.
Thank you very much. That brings us to the end of this conversation. Thank you very much again for insightful answers and for keeping up. And that marks the end.